Hello there. Imagine waking up one day and looking at your spouse, parent or even your own child, and feeling absolutely certain they've been replaced by an identical imposter. Sounds like a scene straight out of a science fiction movie, right? But for people living with Capgras syndrome, this unsettling belief is very real. This rare but deeply distressing condition blurs the line between reality and perception, creating a painful rift between loved ones. So, what is Capgras syndrome? Capgras syndrome, sometimes called the imposter syndrome of psychiatry, not to be confused with the career term imposter syndrome, is a delusional misidentification disorder. It makes someone believe that a person close to them, often a spouse, sibling, parent or child, has been replaced by a lookalike or a double. The person still looks the same, but the emotional recognition part of the brain fails to connect, creating an eerie sense of unfamiliarity. These three scenarios gives an idea of how it happens. Arm 1. The spouse swap. In this situation, a husband might suddenly insist that his wife has been replaced with an imposter who merely looks identical. Even though she cooks his meals, laughs at his jokes and maintains their normal routine, he feels an eerie disconnect. The emotional recognition fails, leaving him unsettled and mistrustful. He might avoid intimacy, refuse to share personal details, or even call the authorities, convinced a stranger is living in his home. This misunderstanding can create painful emotional distance, leaving the real spouse heartbroken and unsure how to respond to constant accusations of being a double. 2. The parent paradox. A teenager experiencing Capgras may look at their mother, someone they've known all their life, and feel absolutely convinced she's not the real mum. Even though her voice, appearance and habits are familiar, the brain's emotional recognition system fails to click, making her seem like a fraud. The teen may resist her authority, distrust her intentions, or even avoid being alone with her. This disbelief creates daily stress in the household, especially since the parent is likely trying to comfort and reassure their child while grappling with rejection and the emotional pain of being seen as an imposter. 3. The professional replacement. Sometimes Capgras syndrome extends beyond the family. Imagine a patient visiting their doctor of several years. Despite the doctor's familiar office, voice and mannerisms, the patient may suddenly feel certain that the physician has been replaced with a lookalike. They might refuse treatment, demand to see the real doctor, or become anxious during examinations. This not only disrupts medical care, but can worsen health conditions that require consistent attention. For healthcare professionals, this can be challenging and frustrating as their efforts to reassure the patient may fail, leaving both sides stressed and distrustful of what was once a steady relationship. Capgras syndrome doesn't just appear out of nowhere. It's often tied to underlying neurological or psychiatric issues. Some common triggers include brain injury or trauma that disrupts the connection between recognition and emotional memory, dementia and Alzheimer's disease, where memory and perception distort over time, schizophrenia or psychotic disorders where delusions are already present, stroke or epilepsy, which may damage brain regions linked to facial recognition and emotional response. Essentially, the brain can still see a familiar face, but fails to connect it with the emotional recognition system, creating the unsettling conviction that the person is an imposter. So, how can loved ones adjust? 1. Stay calm and avoid confrontation. Arguing about the delusion often intensifies distress. Instead of saying, "I really am your wife," caregivers can use reassurance. "You're safe, and I'm here to help." Maintaining a calm tone, soft body language, and consistent responses reduces anxiety. The goal is not to prove reality, but to comfort the individual emotionally. Over time, patience and gentle communication can ease fear and prevent unnecessary conflict, keeping interactions supportive rather than confrontational. 2. Establish routines. Consistency is powerful for someone experiencing Capgras syndrome. Familiar daily routines like eating meals at the same time, engaging in regular activities, and maintaining stable environments help reduce confusion. When things feel predictable, the brain may experience fewer moments of disconnect. Using consistent cues like photos, scents, or favorite music also reinforces a sense of stability. This structured approach not only reassures the person with the condition, but also makes caregiving smoother and less stressful. 3. Self-care for caregivers. Supporting a loved one with Capgras is emotionally and psychologically taxing. Caregivers often feel drained or rejected when labelled imposters. Practicing self-care, whether through breaks, hobbies, support groups or counselling, is essential for maintaining mental health. A resilient caregiver is better equipped to handle difficult episodes calmly and compassionately. By prioritising their own well-being, caregivers not only protect themselves from burnout, but also create a healthier, more supportive environment for the person living with the condition. Capgras syndrome is rare but incredibly impactful, transforming everyday relationships into unsettling mysteries. It's not about stubbornness or lack of love, it's a complex misfiring in the brain that disconnects faces from feelings. While it may seem bizarre, understanding its triggers and learning how to adapt can help families maintain compassion and stability. Ultimately, patience, consistency and professional support go a long way in easing the journey for both the person affected and their loved ones. If you've enjoyed this video, kindly like, share and subscribe for more.